Hello, this is Margie Meady, and I'm recording the PowerPoint presentation called Milieu Therapy, which is another term for a therapeutic community. So the focus of this PowerPoint is to introduce the idea of milieu therapy, where the role of the nurse in a therapeutic setting is emphasized. So that's what milieu therapy is discussing, the therapeutic setting that we create to provide a positive impact on the outcome of the patient's treatment. So here in this slide, you can actually see the importance of milieu therapy because the American Nurses Association, according to Standard 5C of their Standards of Practice for Psychiatric Mental Health Nurses, states that psychiatric mental health nurses provide structure and maintain a safe and therapeutic environment, and they do this in collaboration with the patients, their families, and other healthcare clinicians. So this is the way that milieu therapy is validated as being an appropriate way to achieve successful outcomes with patients that are dealing with psychiatric mental health issues. And so this is part of the standards of practice in this specialty. So what is milieu therapy? It's a therapeutic community. In other words, it's a therapeutic group of people, and it's scientifically structured to allow the environment to provide a effect on behavioral changes and to improve the psychological health and functioning of the individual. So within this therapeutic community setting, the client is expected to learn adaptive coping. They interact in this environment, and then they develop the relationship skills that they can generalize to other aspects of their life. So a good example here, I put that they're creating a meal together. We have an outpatient setting here in Kodiak, and they do this very same thing. They call it a weekly tea party. They get together and they share food, and in that setting, the clients are having the opportunity to see appropriate interactions be modeled by the staff that are involved in these activities. So if a client is appropriately responding to comments by other clients within that setting, or to the staff that is involved in setting up this therapeutic community, then they can generalize that that's the appropriate way to behave in those kinds of situations when they experience them in their life with other people. So they go to a party and they can use those same skills that they've practiced and become proficient in to other parts of their life. So it's specifically designed to model and allow the opportunity for clients to practice their what they've learned about behaving appropriately, interacting appropriately, communicating appropriately in their other parts of their life, not just in the clinical setting. So milieu therapy came into practice in the 1960s through the 1980s, when there was a lot of inpatient treatment of psychiatric clients, because it allowed them to have sufficient time to implement those skills that they learned during the social rehabilitation. So they lived in this environment, and they got to see the appropriate ways to interact with others while they were hospitalized. And although they are still used today, we aren't treating patients in the hospital, so we had to modify them to conform to short-term types of approaches and to outpatient treatment programs. So the example I gave you in the previous slide is a way that was adapted. So there's a lot of programs specifically like for children or adolescents, or clients that have substance abuse addictions, or geriatric clients, for example, that have been very successful at adapting these concepts of milieu treatment to the specialty needs of those clients. And so you'll see milieu therapy also being used out in outpatient settings as well. The basic assumptions of milieu therapy are that the health of each individual can be realized and encouraged to grow. So it's very specifically tailored to what's happening and how that client is currently able to facilitate or incorporate the relationships and skills that are being demonstrated in the environment, the group environment. So each individual, as they're responding, is being encouraged or redirected. So every interaction is an opportunity for a therapeutic intervention. And the client owns his or her environment, so they are able to participate as little or as much as they want to continue to practice these skills. They own their own behavior. Peer pressure is a useful and powerful tool. I gave you the example of that tea party. Very often it isn't even the staff person that corrects or redirects a behavior. I've seen situations where a client said something inappropriate and another client said, that's not an appropriate comment, or you shouldn't talk about that kind of topic in this tea party, or that's a private thought that you shouldn't share with others. They'll correct each other. So peer pressure is incorporated into this milieu therapy. And inappropriate behaviors are dealt with as soon as they occur, so they get that immediate feedback. And we do avoid restrictions and punishment. So in other words, if somebody did make an appropriate comment, they wouldn't be banished from the group or told to leave. They wouldn't have a punishment like they had to not get an extra cookie or something. It's just a modeling therapeutic environment with positive influences that allows that practice situation, and the really good benefit is that they have that immediate feedback. The conditions that would promote a very therapeutic community include that their basic physiologic needs are fulfilled, that the facilities are conducive to achieving the goals of therapy. For example, if we had that tea party and it wasn't in a place where they could sit and use appropriate skills during a situation where you were eating, that wouldn't be conducive. So if they were having this tea party, but they were all sitting somewhere on the floor, or they were being handed food in a way that wasn't really trying to model or emulate what they should be doing in a structure, a social structure like that, then they wouldn't be able to replicate that. So we have to make sure that the physical facilities are conducive to achieving the goals of therapy. The goal of that therapy was to teach them how to behave if they were in a social situation where they were sharing food in a group, and that needed to be appropriate. So they wouldn't do it in a place where it wasn't typical. And a democratic form of self-government exists. As I said, peer pressure is part of that, where they give each other guidelines. Responsibilities are assigned according to client capabilities. So let's go back to the tea party example. If a client had progressed to the point where they could actually be the person that was serving the food and asking others to pass it along, then they would have that responsibility. Whereas if someone wasn't able to achieve that task, then they wouldn't be given that responsibility. So it's a structured program of social and work-related activities, and it's part of the treatment program. So a client would be told that they would be expected to participate in the tea party. It would be part of their treatment plan. Again, it's always individualized. So if they weren't capable of participating yet, they wouldn't be required to. It wouldn't be part of their treatment plan. But if it is, then they're expected to participate. Community and family are included in the program in an effort to facilitate discharge from treatment. So very often the clients would bring a family member to this tea party so that the family member could see how much progress they made, and they would know what they could expect of their family member when they were back home and in another setting in their home that was similar to what they'd been practicing in this milieu therapy. Other examples that I can give you are they take them out to the stores and they teach them the appropriate behaviors for shopping. In other words, the appropriate ways to dress when you go out in public and go to the public supermarket, that you shouldn't take food off the shelves and move it to places that it doesn't belong, that you only put in your cart the things that you're expecting, that you're planning to buy, that you don't just put a lot of things in your cart and then get there and say, oh, I don't want this, I don't want that. You know, teaching them all of these appropriate things can be taken into very specific environments. And, you know, it can be all kinds of things. They take them out fishing and they teach them how to be respectful to the environment, be respectful to other people out there fishing. All of these things are considered milieu therapy. So what is the structure of this therapeutic community? That this care is directed by an interdisciplinary team. In other words, it would be a case manager that would decide that having the tea party or going to the shopping outing would be an effective part of the treatment plan for an individual client. But they might be told at some point that maybe it wouldn't be good because the psychiatrist has decided to adjust the medications, and they're maybe watching for side effects, and maybe the client shouldn't participate in that activity this week. So it's an interdisciplinary team that has input on all of the aspects of this therapeutic community. And it's a very comprehensive treatment plan. So all disciplines sign the plan and meet regularly to update the plan as needed. And the examples of the disciplines that are included in this therapeutic community, this program, are psychiatry, psychology, nursing, social work, occupational therapy, recreational therapy, art therapy, music therapy, dietetics, and the chaplain service. So go back to the tea party example. If the dietitian determined that a patient had diabetes and they couldn't participate in the tea party unless they had the sugar-free snacks, or they couldn't, use certain, they couldn't enjoy certain parts of it, they would adapt it so that that client would realize that they could still participate, but they have to select the sugar-free cookies. So again, a lot of people have a lot of input in this plan that really helps make it comprehensive and individual for the specific patients that are involved in these therapeutic communities. And so the role of the nurse, that nurses are involved with clients 24 hours a day. So they are managing the therapeutic environment of these clients on a 24-hour basis if the patient's in an inpatient setting. But anytime they have an involvement. So another example could be that a client has a personal struggle and there is a nurse or a case manager on call. And that client knows that they are allowed to call that person if they're having trouble or difficulty. Maybe they lost their medications and they can't find them to take their evening dose. They would have the ability to contact people on the team, and that milieu therapy, that therapeutic environment, would be carried through 24 hours a day. So the nurse or the case manager might say, well, what did we talk about? Your responsibility for managing how you take your medications. Didn't we talk about the fact that you always put them in the same place and that you always take them at the same time? So they're reinforcing that therapeutic environment all the time. They have the responsibility to ensure that the client's physiologic and psychological needs are met. What if the client became ill or needed some other kind of intervention because of a psychological or emotional crisis? They would be ready to act in that kind of a situation as well. How the nurses usually are responsible, the aspects of care that the nurses usually care for are medication administration. They develop one-on-one relationships with these clients. They set limits on unacceptable behavior, and then they provide client education. So a very typical situation would be nurses are involved, like it says medication administration, but it's also promoting independence. So for example, the client might come in every week and fill up their medication administration set, their pill pack, like this nurse is doing here with this client. And then the next week the client comes in again and the nurse can see that they missed taking their pills on Tuesdays and Thursdays, and they can talk to the client about why they missed those pills and how can they make sure that they don't miss them again the next week. And so they would work with that client, provide that education, and this is all an example of milieu therapy in place during a medication administration procedure. So here's an example question. Which of the following best describes the role of the psychiatric social worker as a member of the interdisciplinary treatment team? So take a second to pause the recording if you want to think about this for a minute, and then I'll provide the answer. The answer is D. The psychiatric social worker is a member of the interdisciplinary treatment team and conducts individual, group, and family therapy. Here's another example question. A client who is diagnosed with borderline personality disorder approaches the nursing station often with a lot of different various requests. The nurse intervenes by stating, "You may approach the nurse's station only once an hour." Which nursing intervention has been employed? You can pause it and think about it. And the correct answer is C, setting limits on behavior. In this situation, the nurse is responsible for setting limits on unacceptable behavior in the therapeutic milieu. Consistency in carrying out the consequences of violation of the established limits is essential if learning is to be reinforced. So if one nurse said, okay, you can come, the plan is, the milieu therapy guidelines have been put in place by the treatment plan as this particular client can only approach the nurse's station one time an hour, and one nurse enforces that and another nurse addresses what the client needs or addresses the client's approach each and every time they come, regardless of how many times they come up, then that doesn't reinforce what was put in place for that client, and it doesn't help in that situation. So we'll talk about milieu therapy over and over again in this semester because it's part of the treatment plan for a lot of these different conditions, and you'll see it in place in a variety of different examples and situations. So I hope you found this little introduction of this topic helpful, and thank you very much for your attention.